I believe what I've learned. I believe in the long-term health. I believe in longevity and wellness. I'm going to do the hormones. I don't think that, I can see that this stress has just, I don't have anything left. I'm going into early menopause. I rely on my brain. I can't have cognitive decline. And my dad had, strong family history of heart disease. My dad had a quadruple bypass in his early 50s, so heart disease. I looked at all the data, I did the learning, and I decided I did a risk benefit analysis. And it was clear to me that the benefits clearly outweighed the risks.
Yeah. And I'm glad you did.
And I've actually been on hormones now for 13 years. The way I prescribe hormones is what I have personally been doing for 13 years.
In general, since you've been doing this for over a decade now, right? What does the average woman's protocol look like? How do you approach that? If you're in, you're just starting menopause, if you're looking at our average demographic, 45 to 50 years of age, what does that treatment plan for that patient look like?
So I was coming from a background of my wellness practice. I looked at everything, head to toe. I mean, it was a 15-page lab report, cardiovascular factors, immune factors, a few genetic markers, full thyroid panel with antibody. I mean, it was exhaustive. Mm-hmm. I came fresh out of fellowship and was like, I'm going to do these wellness things for patients. And I was used to assessing head to toe for surgery. But when you start assessing head to toe for the whole body, it is far more complex. So stress, cortisol is just such a huge factor. So I was seeing women in their 20s that were coming to me. They weren't ill, but they weren't well. And their stress had basically stolen away their progesterone. So their calming sleep hormone was gone. Most doctors, like myself, don't realize that cholesterol is the building block for hormones. Hormones are made, progesterone, estrogen, testosterone, and cortisol, our stress hormone, are made from conversions of cholesterol down the pathways. Why is that important? It's super important because, first of all, if your hormones are low, what is your body going to do to fix it? It's going to make more cholesterol. So when we're looking at a cholesterol number in a lab for women that are perimenopause or menopause and it's up, and we want to put you on a statin right away, hold the phone. We need to look at hormones because the body's trying to fix itself. Second of all, if you're under stress, you are going to disrupt your hormone symphony balance. You are going to upset the apple cart because in the conversion of hormones, we start with cholesterol, we go to pregnenolone, which is the mother hormone, hormone of memory, and then we go down two different pathways. The one pathway is DHEA, and then estrogen and testosterone. The other pathway is progesterone and then cortisol, our stress hormone. Well, cortisol is our stress hormone. It's also fight or flight survival. And the body is designed that if it senses it's in danger and it needs to run away from the lion and find the cave in the jungle, it shuts down all hormones and everything goes to cortisol. It's called cortisol steal.
Yep.
What's the first thing that cortisol steals? Progesterone, because it's the closest thing. Well, let's talk about what progesterone does in the body. Balances estrogen, huge, builds bone, has a calming effect, enhances mood and sleep, helps manage blood sugar, thyroid function, mineral balance, regulates fluid balance, and progesterone helps decrease the risk of endometrial cancer, may protect against breast cancer. So there's a lot to unpack there.
Yes, there is a lot to unpack there. So let me start with one of my favorite topics you just talked about.
Okay.
The cortisol steal.
Yeah.
Right? So let's talk about the cortisol steal more, which is basically what I see a lot of too in our demographic.
Oh.
Just because people are stressed.
All the time.
So if 39-year-old woman comes in, right? Mm-hmm. Not in menopause. We see this a lot in Nimbus too. When I started this business a long time ago, I thought it was going to be all 52, 55-year-old females coming in, buying test kits, wanting menopause.
Most of my patients are in their 40s.
Yes. And what we saw was, you said it really well earlier, it's not that they're in menopause. It's not that they're ill.
Right.
They don't feel well.
They're like, I'm not myself anymore.
I'm not myself anymore.
I'm edgy. I'm anxious. I'm not sleeping well. I'm depressed. I'm gaining a lot of weight in my midsection.
Retaining water.
I'm retaining water. I'm snapping at my kid. I'm fatigued.
I'm on edge.
I'm on edge.
I'm on edge, right?
And I
see
know
that
this
common
isn't
theme.
me.
Yes. I know this is not me.
Yeah.
And I can't figure out what's going on with me, right? That is a common trend.
And I've asked somebody to check my hormones, and they kind of blew me off. And they're like, "You're too young, and here's an antidepressant."
That's what happens, unfortunately.
Yeah.
But that same demographic, that mom, if you want to call it, because that is the common demographic we see, cortisol steal. What's happening there? Just walk us through in layman terms of, you're stressed. When you're stressed, what is exactly happening?
So cortisol, just to geek out just for a minute, cortisol we don't want to give it a bad name. It's vital for our body.
Oh, yeah.
Cortisol is in charge of two parts of our body. The one part is our daily circadian rhythm. Between 7 and 9 every morning, our body puts out it should put out a nice big burst of cortisol. It's like your body's natural cup of coffee in the morning. Get up and go.
Yeah.
Between 7 and 9 a.m. Then it drops off significantly by mid-afternoon, and it needs to be at its lowest by night so you can go to sleep. Because too much cortisol, your mind's not going to shut down, going to disrupt sleep. And then the next morning, it happens all over again. So that's circadian rhythm and cortisol. The other way cortisol works is danger. Fight or flight. Something stresses you out, and your body reacts by, what it does is it puts more glucose in the bloodstream because you need that to run faster from the lion to escape and make it to the cave.
The lion analogy is so good, right? Because it just makes sense. You see a lion when you're just walking, you're like, oh.
Yeah, you've got to run to the cave.
Got to run.
But we weren't designed that 5 minutes later, you left the cave and went looking for the puma and the jaguar and the tiger.
Yeah.
We were designed that we stayed in the cave. We let our adrenals, which is what makes the cortisol, we let our adrenal glands and our stress whole axis settle down, the brain, the adrenals, it all settled down, and then you were at baseline again, and then you cautiously left the cave. That is not modern day life. Stresses are coming at us left and right. And as we get more and more stress, the brain can't really differentiate anymore. Is this a lion or is this just a kitty cat? Yeah. Is this like a little kitten? Everything feels like danger, and our adrenals ramp up, and we start making more and more cortisol. We start dysregulating our blood sugar, our metabolism. We start packing on the midsection weight. We start getting inflammation in our body because cortisol, let's talk about what cortisol does in the body. Increases energy and metabolism. It's I call it the spark plugs of our body. Thyroid being the engine, cortisol being the spark plugs. Helps us respond to stress, trauma, and infection. Helps regulate blood pressure and blood sugar. Reduces allergic and inflammatory responses, so there's a connection to the immune system. Interacts with progesterone. When you have cortisol surges from stress, it blocks progesterone receptors. So let's back up for a minute. It steals progesterone first, and it blocks receptors. It's a double whammy.
Yep.
Okay? And when cortisol is elevated, thyroid hormone cannot get converted to the active form. This is why my thyroid failed in my mid-30s. So cortisol is not evil. It's anti-inflammatory. It's doing tons of things in the body. It's only a problem when we have prolonged stress levels and it goes high, and then eventually the body just can't keep up, and then we end up in adrenal fatigue because our body can't make the cortisol anymore. Now we've got a brain fog, inflammation, fatigue, aches and pain. I mean, we are down and out.